All right. Hello, everyone. Thank you for joining me for this week's Q&A on YouTube, X, and Facebook. Thank you all for joining. Very sorry for the delay. Just got caught up in some work meetings and wasn't able to join at the normal time. So thank you all for being patient. Very sorry for the delay. Just sort of get straight into the questions here. There's one from the Stoic that says, "Hi, Anthony. Does a carnivore diet cure IgA nephropathy, and in what time does protein hematuria improve? Is there any benefit to caloric restriction for autoimmunity?" I haven't found any benefit to caloric restriction for autoimmunity. Just eat the right thing, and specifically don't eat the wrong things, because there's certain things that just trigger this what we call autoimmune sort of reaction with this immune response and damage to our bodies. So if you just eliminate those things, then that should do the trick. You don't have to then restrict the amount of things that you're eating if they're not something that triggers them. That makes sense. So doing a strict carnivore diet typically helps, generally, because you're removing a lot of these things that will damage your body and trigger these autoimmune problems. IgA nephropathy, I mean, we don't have specific studies showing this one way or the other, but I have absolutely seen people with IgA nephropathy improve dramatically with carnivore diets. And again, just general autoimmunity improves quite a lot. So, oh, sorry, just problem with what the hell's going on? Okay, sorry about that. So it's one of those things that we don't exactly have huge amounts of data on at the moment, but there are certainly anecdotal cases where people have improved from IgA nephropathy. So certainly worth trying. There are 1,000 other benefits that you're gonna find from fixing your diet anyway, and it could potentially help with the IgA nephropathy too. So it's worth checking out. As far as when does protein hematuria improve, that's going to be different for different people. And but just be aware that higher protein diets do not damage your kidney function. In fact, studies show that it actually improves kidney function. If you're looking at kidney function and you are eating a higher protein diet, looking at creatinine isn't necessarily the most accurate way of doing that. You want to check your cystatin C, and that's a marker of your kidney function and filtration rate that is not dependent on protein. So if you have more muscle mass or you have a higher protein diet, your creatinine is always going to be a bit elevated, but your cystatin C shouldn't get elevated due to that, those factors, and that's going to be more accurate. So that's what you want to check as well. And again, if you're losing protein in your urine, you actually need to replace it. The protein is not causing that problem. That problem exists, and a symptom of that is that you're losing protein in your urine. That's like having an oil leak on your car and say, well, just don't put oil in the car, because then that'll stop the leak. We don't want to lose all this oil. That oil is causing the oil leak. And it's like, well, no, actually, you're losing oil, but you need the oil. You're losing the protein, but you need the protein. So actually having a higher protein diet can actually help replace the excess protein loss that you're having as well. Terry Bond has a question, says, what are your thoughts on things to check if carnivore is not reducing or eliminating inflammation after several months? Thank you. Well, I mean, you can always check your inflammatory markers, your things like your high sensitivity CRP, your ESR, those sorts of things. Even your ferritin, if your ferritin is very elevated, that can be an inflammatory response as well. Platelets getting elevated, that can be an acute phase reactant as well. So these different sorts of inflammatory markers, you can check them, and if those markers are very low, well, then do you actually have increased inflammation? Is your problem actually an inflammatory problem, or is it something else? Also, is there anything in your carnivore diet that is not carnivore? Are you still drinking coffee? Are you still having tea, artificial sweeteners, these sorts of things? Just because you've eliminated 99% of the non-carnivore things doesn't mean that getting rid of that last 1% wouldn't have a significant impact and benefit to your health. Coffee is very pro-inflammatory, and a lot of people find that they have a lot of soreness and stiffness and aches and pains when they drink coffee. I haven't had coffee in years, because if I do, my muscles are sore for 2 days after I have one cup of coffee. with no sugar, no anything, right? Just 1 cup of black coffee, and I feel sore. Also, my patients who are on these, there's a lot of anti-nutrients in coffee as well, and so they block out the absorption of vitamins, minerals, proteins, fats that you want, and they also block out the absorption of medication. So I have my thyroid patients who are on thyroid medication. If they have coffee within 2 hours of having their thyroid hormone medication, it massively reduces the uptake of the thyroid. Some it's like they're not even taking thyroid medication at all. And I've seen dramatic improvements when people delay their coffee by at least 2 hours after they take their thyroid hormone. Eliminating it is even better. So those sorts of things. But you want to see is this actually an inflammatory thing? Have you actually gone full carnivore? If there's anything else like coffee or tea, get rid of it. And see how you go. Are you having enough fat? Are you getting your ketones up? Elevated ketones can actually suppress inflammation even more. And so, you want a proper diagnosis. Is this an inflammatory issue, or is this something else? Because if you're barking up the wrong tree, then that's not going to get you anywhere. Are you actually full carnivore? Not everybody is. A lot of people just move in that direction strongly to eat a lot of meat and a lot less of these other things, but they're not full 100%. The easiest solution that most people have is that if they're going carnivore and they're not having the effects that they think they should have, or they see other people having, are they actually 100% carnivore? If you have any of these little things left in, first thing you do, you cut them out. It's real easy, and you see what happens. And that takes care of the issue, you're done. And in most cases, it does. So just think about that and go from there. Let's see. Okay, so this is just more of a comment. It says, Dr. Chaffee is right about carnivore and pure carnivore. I love to listen to him and helps motivate me to stay the course when temptation creeps in. Well, thank you for that. I appreciate it, and I'm glad that it helps. Here's a question from Kuvo Novotny. Says, can a carnivore diet work for someone with an F1? So like neurofibromatosis 1. I've read that NF1 patients may have altered metabolism and are often told to eat carbs. Wondering if low carb, no carb can still be safe or beneficial. Yeah, I hadn't heard ever a recommendation for NF1 patients to eat carbs. So you'll eat carbs anyway, and so I haven't really seen anything to do with that. But I haven't seen all that many people. I maybe come across 1 or 2 NF1 or NF2 patients that have gone carnivore and seen some improvement, but it's not going to be enough to really give you a good a strong idea of what might happen. But again, you're going to improve in a lot of other ways too, and it can make your life with NF1 a hell of a lot easier than being carnivore than otherwise. Could potentially help. We have these genetic predispositions. Well, that's just genetic. Well, a lot of things are genetic, but they have a genetic predisposition and environmental trigger. There are multiple genetic issues, very serious, even life-threatening or fatal genetic conditions that people have then turned to carnivore and are now finding that that's actually reversing these issues. So that's something that you don't just dismiss. Just because no one else has found something that works for it doesn't mean that we can't find something. So certainly worth trying. I don't think it's going to hurt you. It's just eating a natural food. So just eating your natural biologically appropriate diet is not going to hurt you. And it may or may not help. I don't know as far as F1 is concerned. I can't tell you certainly one way or the other like I can with like Crohn's disease. Like yes, it will help if you have Crohn's disease. But with NF1, I just haven't seen enough people with this to even give you an impression from my sort of practice experience. But it's certainly worth doing because you're going to get all these improvements anyway. You're going to get a lot of improvements in your health overall. And so if you get if you don't get any headway with the NF1, you're still going to get all the other improvements that people get when they go carnivore. So certainly still worth trying. Oh. So there's a question from Nefe Banana Pazir. Sorry for butchering your name. I'm sure I did. Can someone with Hashimoto's for 30+ years recover on carnivore? It depends. It depends on how much damage was done to the thyroid during those 30 years. But I have well over 100 patients with Hashimoto's, and everyone that is able to manage to stay on a strict carnivore diet, which most of them are, improved dramatically. I mean, certainly you see those antibodies start coming down, absolutely, and you can halt the damage to the thyroid. But do you have enough thyroid left to recover and start to make enough thyroid hormone that you don't need to take pills? That's going to be just sort of a wait and see sort of thing. If you are doing this, just remember that it can take a long time. It can take a long time to bring these antibodies down, but the damage should have stopped long before that, as long as you're not bringing in these harmful chemicals that I believe are causing that problem in the first place. And then the thyroid is very slow healing. It's not even thought to be able to heal, but I have seen people heal it. And so, but it can take a year or 2 years, things like that, to recover. And it may also be that you don't recover all the way, that you still need some medication. If your thyroid is not able to recover at all, then you may have to stay on the same dose that you're on. A lot of people are able to come down off their thyroid medications, and many people are able to come off their medications. But again, it depends on how extensive that damage is, and if that damage is permanent, because there is such a thing as damage done. And so but again, it's definitely worth trying, and you'll get a lot of other benefits as well. It should stop the damage from progressing. And if you have one autoimmune disease, and Hashimoto's isn't considered an autoimmune disease, you almost always have multiple autoimmune conditions. And I think that fits very well with this sort of toxic theory of autoimmunity, that you bring in these toxins like lectins and glyphosates and these sorts of things into your body, and then they don't just go to the thyroid or just go to the colon. They go all over the place. And so they're damaging all sorts of things in your body, and your body's making an immune response to those things, and you're getting what we would call multiple autoimmune conditions, which all ultimately come back to just this toxic exposure that you can get rid of, and it sort of addresses all of them. So it's worth doing anyway. It's Carnivore Phil. Hello, happy to catch a live stream. Well, it's good to have you here. Thanks for coming by, and thanks for stopping by for the live chat. And again, very sorry to keep you guys waiting. There's a super chat from Penelope Husker. Thank you very much, Penelope. I really appreciate it. Penelope says, I got a rescue kitten. What do you recommend to feed a species appropriate diet for felines? I know it's a little off topic, but I feel like our pets can benefit as well, or they definitely can. And just remember that cats are, considered obligate carnivores even by, the establishment. So, and I would consider humans obligate carnivores as well, because we are obligated to eat meat. There are nutrients that we cannot get any other way. And a lot of the plant toxins are quite harmful to us. So, kittens, cats, they need meat, and that's what they thrive on. And they need raw meat, because they need things like taurine, which is cooked out, is denatured when you cook meat. So you can look up the Pottinger's cats study that was done 100 years ago. It was really interesting. They gave cats raw meat versus cooked meat, and massive differences in their health, and multi-generational knock-on effects as well. And so every generation they got worse and worse and worse, until finally they couldn't breed anymore. And then they started giving them raw meat, and then they were able to breed, but then they didn't just breed back to the normal size, stature, and health of the original cats. It actually took 4 generations before they were back to the normal size and health of the original cats that they started with. So that's really interesting. That's called Pottinger's cats. It's a very interesting study, and people have YouTube videos and things like that where they discuss it as well. So that that's something that you can find. But cats need raw meat. Dogs do best on raw meat as well. And they require taurine. Taurine is an essential amino acid for cats. And so you want to give them raw meat. You want it to be pretty lean, though. They don't need much fat. I mean, think about what they're going to eat in nature. They're going to eat little birds and mice. Not much fat on there. There's going to be some, but not much. So very, very lean stuff. And even giblets. So, chicken giblets, gizzards, hearts, those sorts of things. Those cats just love those things. Raw. If you're worried about that and you want to sort of sear the outside and maybe kill off some bacteria, fine. Leave the inside raw at the very least, because they need it. They need those nutrients. If you have too much fat, you'll know about it because they're going to get loose stools in the form of explosive diarrhea. So it's not something that you want unless you enjoy cleaning up that sort of thing. So that's what I would give them. We give our cats very lean, and our dogs very lean meat, raw meat always. And so we'll get lean ground beef or ground chicken, those sorts of things. And the chicken gizzards are really good. Hearts, those sorts of things are great, excellent choices. And what else? In a pinch, if we don't have sort of anything else, like cheap whatever, you can actually give cats like a chicken wing. Don't eat the whole thing. If it's raw, it's okay. They can actually eat the bones. They won't splinter off and hurt them, and so they can eat that whole thing. There's a gentleman that I had on the podcast, a really nice guy. He's a vet from the UK, and he's all about raw food dieting for the animals. But he is really feels strongly that you should actually give them like the whole chunk of animal, like a chicken wing or a drumstick or something like that, because them sort of chewing and ripping that apart and ripping it off the bone, maybe even chewing through the bone, it's good for their jaw development and their teeth, as well as giving them the essential nutrients that they need. And dogs, giving them meat on the bone sort of thing, pull it off and chew it off. It's good for their teeth. It's good for their jaw, especially during development when your cat's a kitten. So those sorts of things. So so maybe give that a try and see how you go. Typically, they'll eat until they don't feel they need to, and they'll sort of self-limit, and you can sort of see how much they need. And they'll typically won't get overeat to the point that they'll start putting on unhealthy fat. Our cats are very lean. There's a bit of they have a bit of fat on them. They're not just like 2% body fat or anything like that, because they're not supposed to be. They're supposed to have a bit of healthy fat that sort of keeps them healthy in case they don't get anything to eat for a few days, and that can sustain them and maintain them. So, but they don't get obese. I mean, I basically give our cats whatever they want. They eat what they want, and they leave the rest, right? So that's what I do anyway, and I don't feed them anything else. So yeah, good luck with that. And I think you're doing the right thing by the cats. They'll be very healthy. Probably won't ever have to take them to the vet unless there's like an accident or something like that, because it's just a very, very healthy way for them to eat. This is a question from Judy from Facebook, who says, are you familiar with Maurice Dare on blood work? He advised on being on carnivore for a heart attack. No, I'm not familiar with him, and so I don't know exactly what blood work they advise, and specifically for a heart attack. No, I'm not sure actually. So if you can pop that up and sort of say what he's suggesting and what you were wondering, then that would be interesting. I mean, it's I don't know if this is the context of this from like to prevent a heart attack, or if this is something to if you've had a heart attack, then things that he's concerned about. So I'm not too sure about that. But typically if you're concerned about your cardiovascular health, you're looking at your fasting insulin, fasting blood sugar, HbA1c as well. But I think that it's more fine-tuned to look at the fasting insulin and blood sugar. And then you want high HDL, low triglycerides. I couldn't care less if your HDL or your LDL is high. I think is probably better if it is a bit slightly higher than their reference range. Same with the total cholesterol. Yeah, those sorts of things. Just being metabolically healthy, low glycemic damage, having optimal levels of B12 and low homocysteine. That's also optimal because homocysteine can damage the arteries, the lining of the arteries, and the lining of the arteries. And so homocysteine, basically whatever the reference range is, cut that in half, and you want to be below that for homocysteine. Those sorts of things are really good indicators of your cardiovascular health and potential risks. So Jonathan from YouTube has a question. Jonathan Hubbard Shaw says, can you discuss some things that carnivore doctors disagree on, like fermented veggies and never doing zone 2 cardio? You know, never say never. You know, I mean, like the thing is that, you know, just doing some cardio is fine. You know, I mean, the argument is that if you do it for prolonged periods of time, like over half an hour, 45 minutes, that can increase cortisol. You know what? It depends on what you're aiming for. You know, that can have catabolic effects on your musculature. Like you can actually get sort of thinned out and things like that, and you start catabolizing your muscles. Not as much on a ketogenic diet, ketogenic carnivore diet. It's very anti-catabolic. So your ketones actually help preserve your muscles, and typically you won't start catabolizing your muscles as long as you are in ketosis and you have a lot of ketones available and things like that. So that's less of a concern, but the increase in cortisol, you know, that's what most people are concerned about. It also depends on what you're doing, how you like to live your life. You know, for me, I like feeling fit and being able to run and just do all these sorts of things. You know, mostly the type of running that I did was sprinting, and so I'd be doing sort of what I sort of considered endurance sprinting. And so I just, you sprint as hard as you can for as long as you can, and you'd rest and you do it again and you do it again and you do it again, and fairly soon you can just basically sprint for prolonged periods of time and just not have a problem. Or do wind sprints where you're running really hard and then you're sprinting and all that sort of. And those are really good exercises. I mean, I didn't get runners. I had big, massive, quads because of this, and I could squat like an insane amount just because of how much I sprinted. Because of how much muscle development I got from that. So that's the main thing is that people get worried about the amount of cardio that you do and how long you do it, because that can increase your cortisol. If you're training for a field sport and you're playing soccer, you're playing rugby, or you're playing football, that's something you need to do. That's part of it. But it is more of the sprinting, sort of wind sprint. You're going hard as you can, and then you're sort of pulling back as hard as you can and pulling back. So that's not just jogging for hours at a time, right? So typically when you're doing more anaerobic exercise, you'll lower your cortisol and improve other hormones like growth hormone. Or it can actually increase testosterone in men as well. And then doing a lot of cardio, longer than half an hour, 45 minutes, certainly, that will actually raise cortisol and can lower and suppress growth hormone in particular, and testosterone in men. And so that's sort of why people say, hey, maybe don't do as much of that. Do it for a certain extent, but try to focus on more high intense exercise. That's why they do that from that cortisol standpoint. Fermented veggies, do you need fermented veggies, or is fermented dairy products, possible? You're still getting those bacteria. I mean, the argument for having fermented foods is that you're getting these healthy bacteria, which is great. But you have to ask yourself two questions. One, do you need them? And two, can you get them from a carnivore source? So I mean, the Inuit and Native Alaskans would eat fermented fish heads. So do you need to ferment veggies? If you're going to have veggies, I would ferment them, because we've fermented things for thousands of years in order to lower the toxic load and increase bioavailability of those nutrients. Plus, you're getting some healthy bacteria. But again, let's go back to the beginning. Do you need those bacteria? Is your microbiome hard up and in need of an addition from something like fermented veggies? If it's not, then what are you taking them for, right? If you just had horrible gastroenteritis or a long bout of antibiotics for some sort of other infection that was causing a problem, and you want to replenish your microbiome, and you want to take some ferments for a while, okay, but do you need that long term? I don't think that it's evident that we need to take fermented foods for the rest of our life, because there are plenty of people that don't do any of that and they have exemplary microbiomes. You have the Inuit that have exemplary microbiomes on their natural diet. Are they having some fermented fish and these sorts of things? Maybe, and is that contributing? Maybe. But you have to remember as well that we have bacteria in our mouth, and traditional microbes in our mouth are not considered to be very healthy or nice and pretty nasty bacteria, but that's looking at people on a normal standard diet. You have a very different oral biome when you eat a carnivore diet or you eat any other diet. So you look at animals in the wild, they don't rot their teeth out, they don't get cavities, they don't have dentists, they don't have braces. Their oral health, your oral health is indicative of your overall health. And this is something that we've known for a very long time. It's sort of a canary in the coal mine. Your mouth is sort of getting all rotted out. The rest of your body is probably getting some serious damage as well. When you're on carnivore, you don't have any of those problems, right? Because you're eating what you're supposed to eat. If you're eating something that's rotting your teeth, you're not eating the right thing. You're not eating a biologically appropriate diet. It starts and stops with that. You don't need to go any further. And so that's actually really good evidence that carnivore diet is really healthy for us. I mean, look at these native populations. You go to Africa, Native Americans and Native Aboriginal Australians. What is it they always said was, you go to these guys, they're very dark skin and bright white teeth, right? They didn't have dentists, but they were just eating what they were supposed to eat, and they had very healthy teeth. So you're going to have a healthy oral biome as well. And so the whole point of the fermented foods, you don't just eat fermented foods. What you do is you put them on meat, you chew it together, you chew it up very thoroughly, and then you swallow it together so you can hide some of those bacteria in that center bolus of food. Okay, because if you just eat them, they go into your stomach acid. They're going to get fried from your stomach acid. It's not going to do anything. If you just drink kefir or just eat plain live culture yogurt, it's just going to die in your stomach acid. They're not going to get any further than that. You have to eat them with solid food, chew them up together, take them down. So you're doing that with your oral biome all the time. The bacteria that's in your mouth is going to get in your food, and if any of this is passing your stomach acid, that's passing your stomach acid as well, and that can sort of replenish your microbiome in your colon. And so that's probably why we see people who don't take probiotics, who don't take fermented foods, that they improve their microbiome as well, and actually get new species of microbiota that they didn't have before. A good example of this was Ben Azadi, who documented this. He's been doing a clean, ketogenic, meat-heavy diet for years, over a decade, and then he did a microbiome test, and they found that it was good, it was okay, it was good, it wasn't great. And then the recommendation was eat less red meat and eat a lot more fruits and vegetables and fiber. And he just said, I did the opposite of that, cut out all fruits, vegetables, and fiber, and actually almost exclusively ate red meat. 3 months later, his microbiome is perfect, and he's some like 6 or 8 new species that weren't there before. He's like, where the hell did those come from? Because he wasn't having fermented foods. So if you do need to replenish your microbiome, and you think that fermented foods can help with that, can you think, does it have to be veggies, or can it be lactobacillus fermented dairy? Okay, fermented fish heads, if you swing that way. Does it have to be the veggies, right? And then the other question is, once you reestablish your microbiome, do you have to keep eating those ferments in order to perpetuate your microbiome? I would say no, because what your diet is going to support your microbiome. And so as long as you're eating the right thing, you're going to support the right bacteria. And so I don't think you have to keep eating the fermented veggies, and we haven't really looked at that one way or the other. But again, people that just eat a normal carnivore diet have very healthy microbiomes. without any ferment. So those are things to consider when you're thinking about fermented foods and things like that. Okay. So Edison Twain, thank you very much for the super chat. I appreciate it. Thoughts on going full carnivore after several months? So several months of what exactly? So several months of maybe partial carnivore. I suppose that if you want to sort of clarify that question, maybe we can answer that a bit better. But if I understand what you're saying, I mean, there's sort of a difference between going full carnivore straight away, going cold turkey, and also just sort of easing into it and then going full carnivore. It's dealer's choice, whatever you want to do. There's arguments from a microbiome point of view that, you know, as the microbiome changes, it's sort of nicer to do it in a more gradual approach, and let that sort of transition a bit easier, so you don't have any sort of blowback from that. Bart K would certainly be a proponent of that. I've seen a lot of people. I went cold turkey. A lot of people that I've treated go cold turkey and haven't had that issue, which is good. At least some people are going to be fine with that. If you find that there's some sort of issue, maybe try transitioning a bit more slowly and see if that changes anything. You can always check your microbiome and see if there's any problem there or any sort of other issue. But I think it largely comes down to personal preference and can you get your head around doing just full carnivore straight away. Not everybody can. They're just like, well, hold on a second, that's too much for me. And they want to transition. So if you're going to transition slowly, you just have to have a set sort of timeline. So like, okay, today I'm cutting out all junk food. No more junk food. It's all whole food from here on out, and I'm focusing on fatty meat. Great. That's day one. Next Friday, you're cutting out carbs. All carbs, grains, sugars, seeds, beans, legumes, any starchy vegetable or fruit, gone. So now you're ketogenic. The next week, you're cutting out nightshades, potatoes, tomatoes, eggplants, pepper. Some of those are already been gone with the carbs. Then next week, all beans, seeds, legumes, nuts, everything gone, right? And go on like that. And then the next week is going to be high oxalate sort of things, nasty ass kale, that sort of stuff. You cut those things out, and now you're having smaller amounts of some non-starchy veggies, and you mix them up. You don't have the same thing every day because they can build up those toxins in your system if you eat them every day. So then, and you're limiting these things, so it's sort of like 2 fist-sized servings of non-starchy vegetables. That's the typical way of doing keto, and you're eating as much fatty meat as you care to. You're just eating intuitively. And then you have a day, sort of 4 or 5 weeks down the chain, depending on how you break this down, that everything's gone except fatty meat and water, and that's it, right? And so you want to have an end date. You don't just say, oh, I'll sort of cut down. I mean, those are guys that sort of plan on cutting down smoking and end up, quitting smoking for 20 years, and it sort of never happens. But eventually one day they just go, okay, I just have to stop. I just have to stop. And so, if you're smoking, you're like, I will only smoke. You're on a pack a day. Okay, I'm going to cut down to 15 a day, and then next week I'm going to cut down to 13 a day, and then 11 a day, and then 9 a day, and then all the way down to I'm just having 1 a day for another week, and then that's it. See you later. You have to have that in a sort of a stepwise progression. You're never gonna do it. So that's what I would do with this as well. And at some point you have to stop. You will have to go cold turkey, but you sort of wean yourself down. You're sort of more accustomed to eating, like this, and then you're sort of cutting out a little bit here and there, and then eventually it's just like, all right, we'll actually feel good. So that's what I would do if you're doing that. And if you've been sort of like working your way in after several months, again, at some point you have to just cut this stuff out. And if you are sort of taking months to get it out, that's a good demonstration of why you need a set timeline on when to cut these things out. So if you haven't done that yet, have a timeline on when you can go, and then eventually go full carnivore, and you'll be better off for it. You really will. Okay, so thank you very much, Bliss Girl, for the super chat. I really appreciate it. She says, hello, I've been on carnivore for a few months, hoping to fix my hormones. Heavy cream feels like a tonic right now, but is that that it's addictive nature. Thank you for all you do. Well, potentially, I mean, there are cases of morphines that have sort of an addictive, compulsive sort of aspect to that, that most milk products will have. Typically, butter has less of that, doesn't have as much of that compulsive sort of feeling to it, and certainly ghee has pretty much all that stuff taken out. You may need a lot more fat than you've ever had before, and so sometimes that cream can help improve that. Maybe you can try to supplement things like butter instead, and then you won't get that compulsive sort of feeling. You won't get those occasional morphines, which can cause you to put on weight that you don't want also, and then make you eat more than you want as well. But you certainly need the fat. I mean, it could very well be that you've been under eating fat for most of your life, just like the rest of us, and your body is desperately trying to get more of these essential fatty nutrients that it's going to find in the cream as well. So you can sort of see, you can just sort of see if you can substitute another fat source from that, and if you can, then that's great. And also, if you start having difficulty losing weight, or something's going on, maybe you're putting on a bit of weight, then definitely think about the cream, because that can lead to fat deposition that you don't really want as well. So yeah, let me see here. Okay. All right. Next question is from Carnivore Phil. Thank you so much, Phil, for the super chat. It's very kind of you. Can you please talk a little about oxalates and any impact on our gut? Can being on carnivore lead to kidney stones when oxalates leave your body? How can we make it easier? So, I mean, you can potentially get this oxalate dumping if you have a lot of this buildup of oxalates. You can potentially then start, after you sequestered all these oxalates, you can start losing them and start pushing them out again. And if that is the case, and you're doing a lot of that, then it is possible that you can actually form stones, because calcium will bind to oxalates. Oxalates will bind to calcium, and then you'll draw that out in your kidneys. And so 75% of kidney stones are calcium oxalate stones. And the oxalates, typically come from plants. A very, very small amount will come from other sources. Vitamin C, excessive amounts of vitamin C will convert into oxalates. Degradation of collagen will turn into oxalates, but you make maybe 1 or 2 milligrams of oxalates from the degradation of your collagen. So you're not, then you can deal with up to about 50 milligrams of oxalates a day in your diet and not have a problem. So it's not a very major issue when you're talking about naturally occurring oxalates in our own body on a natural diet. So it is possible to get a lot of oxalates in your system when you have deposited a lot of these oxalates, and potentially getting deposition elsewhere, like in your kidneys, is possible. So the thing to do to avoid the kidney stones, you just drink tons and tons of water, especially if you feel that you are dumping a lot of oxalates. Like if your urine's a bit cloudy, or sort of looks like there's almost some sediment in there or something like that, that could very well be this calcium oxalate that's sort of coming out of your body. And so you really need to hose down the water so that you can just clear this stuff out, so it's not building up and depositing in your kidneys and things like that. As far as the impacts on your gut, I mean, the oxalates generally, I mean, they come with all these other sort of toxins that are always going to be harmful to your gut, the lectins, etc. But once you're on a carnivore diet, I mean, nothing should be coming into your gut from your diet that's going to be that going to have high oxalates or anything like that. And so while oxalate dumping is thought to basically be able to affect sort of any tissue and organ in your body, that would be a less common one that I would see as well. Quite often you see little sort of white sort of crystal-y things coming out of your eyes and your sweat, certainly in your urine. Joints, you can get gout from oxalates. Oxalates are a known cause of gout. There are multiple causes of gout. It's not just uric acid crystals in your joints. So that's something to see. But yes, I have seen people long term when they sort of have these dumping, they start having real bad joint pain and things like that, and they might be able to develop some kidney stones. It's not that common, but I have seen it happen. So you just hose down the water if you think that's a problem, and so you can just clear this stuff out and dilute it out so it doesn't build up and form stones. But eventually you're going to get all this stuff out of your body, and that's the main thing, and then you won't have a problem with that long term. But it can take a while. It can take a very long time. Sally Norton is of the opinion that she's the resident expert on oxalates, that this can take up to 10 years for some people. Now, most people, she said, will never have those huge problems. Most people maybe have a bad week or two where they're sort of dumping this stuff out, and then it's just sort of normalizing and sort of is leaving the body in more normal, controlled levels and don't have the very serious problems. But there's other people that can get very, very sick from this stuff dumping their body, and that's the ones that you need to sort of address in the ways that she suggests. But most people will be fine, and so just keep up with the water, eat properly, and you should be fine. If there's any issues, you address those when and as they come up. But most people don't have to most people just weather it, and it just gets out of their system, and you're good. Okay, so next question is from a #1 Savage. Thank you so much, Savage, for the super chat. Sprint. Thanks, Dr. Chaffee. Feel the pain, then feel your hard body 6 months later. Work the oxalates and poisons out. Don't give up. So yeah, so it's just sort of a comment, and yeah, I think that I agree. Just work hard, eat right, and your body will come around. I mean, people get very antsy about not seeing these dramatic improvements straight away, or maybe other people are getting faster improvements. And look, everybody's different. Everybody's coming to this from a different starting point, maybe metabolically sick or maybe nominally healthy, and then they can just hit into this and they're just all these improvements, and other people are very unwell, and they have to undo a lot of damage that has happened to their body, and they have to correct a lot of hormonal issues and malabsorption or malnutrition issues, maybe even malabsorption issues. And that's another thing too. Some people that don't get as many benefits after several months are like, hey, what's going on? You maybe check their bloods, and actually you see that they're deficient in a number of things. They may be better than they were, but they're still quite deficient, and so they're not going to get the same improvement until those are corrected. And if they have a malabsorption issue or a methylation issue, MTHFR or one of the others, it may be that they need more organs, or maybe with a serious malabsorption issue, they may actually have to have a different vector. So sublingual B12, for instance, or injections, or even iron infusions, those sorts of things, if their body is just not capable of absorbing enough nutrients, even though their diet is replete with these nutrients. That's something that can make a big difference in people's health, is correcting those specific nutrients. And yeah, and then just keep working hard and keep going, and eventually you'll get to where you want to be, as long as you're mindful of having the healthier options. Some people really do need grass-fed and finished meat and organs. They do best with those, especially if you have these sort of issues with sort of lower nutrients that, for whatever reason, that other people might not have. Like me just eating normal food, my levels are up in those optimal levels, especially when I'm having grass-fed and finished pasture-raised meat without even having organs. Definitely all of the optimal ranges. When I'm just eating Costco beef, it's all way better than everybody else, but it's not quite as optimal as when I'm doing different quality meat. That makes sense. There's objectively more micronutrients in pasture-raised, grass-fed, and finished beef than there is in USDA grain-finished beef. Okay, so that's not a surprise there. But even with the grain-finished Costco beef or Safeway beef or Tesco beef or Kohl's beef, it's still going to be so much, many times better than anything else you've ever been eating, and you're not getting it with the anti-nutrients that are going to block out even more of that stuff. So you're going to get an improvement either way. It's a question from Country Bumpkin. Thank you so much for the super chat. On Carnivore, total cholesterol is 341. HDL is 51, triglycerides 160, and LDL-C is 257. Non-HDL 290, and HDL and the ratio is 6.7. My doc wants me on a statin, and I don't want it. Well, at the end of the day, it is your choice. It's your body, and it's really important for you to have autonomy in your own health. Your doctor is trying to do the best thing for you, and it has your best interests at heart. But the way we are trained is not to address root causes. It's to match problems with pills. And then they've co-opted the medical profession to just be the on the floor salesman for the drug companies. That's really what it's come down to. And we've been taught in such a clever way that we don't even realize it. We have no idea. We think that these are the best ways that we can treat people. We have these tools. Here are these problems, and we're taught these are the tools that we can use to help people and heal them. And then they're not, unfortunately, by and large. Some of them sort of mitigate symptoms, and many of them don't even do that. Some of them, like statins, treat problems that don't even exist, in my opinion, because cholesterol is not a disease. Atherosclerosis is a disease, and there's no direct evidence to show that elevated cholesterol or LDL causes atherosclerosis. None. There isn't a single randomized controlled trial in humans showing a cause and effect relationship between cholesterol and atherosclerosis. None. Not one. And in fact, there are at least 5 large-scale randomized controlled trials in humans, double-blind placebo-controlled trials, that actually show the opposite. That showed as you lower cholesterol and animal fat, more people die of heart attacks and strokes as a result. So, then you go into the epidemiology, go a stage down, and you say, oh, well, look at the Framingham study. That shows that increased cholesterol increases cardiovascular mortality risk. No, it doesn't. That was what was misrepresented by the American Heart Association 2 years after it was published. But the actual Framingham study actually showed the opposite, that as you reduced total cholesterol, cardiovascular mortality rate went up. So people dying from heart attacks and strokes went up as cholesterol went down. That's a correlation. It's not a causation. So then you just get a theory and you go and test it with a randomized controlled trial, which all showed that lowering cholesterol kills people. So not my cup of tea. If you have a large burden of soft plaque, there is an argument for having statins, which are known to calcify plaque. So it'll, first of all, it'll raise your CAC score. Some people say, oh, your CAC score is high, you need to be on statins. What's that going to do? Is that going to lower my CAC score? Oh, God, no. That's going to shoot up. But why is that? It's because it's sort of, your original CAC score is just basically you have plaque, right? But it's only looking at the hard plaque. It's not looking at soft plaque. But if you have hard plaque, then you have soft plaque as well. How much? Who knows? But once you start statinizing yourself, then you're going to have a lot of calcium, because that is thought to stabilize, to calcify these plaques. And those calcified plaques are considered stable. They don't rupture. It's the soft plaques that rupture. So, if you had a large burden of soft plaque and they could show that on imaging, like a carotid Doppler or, CT angiogram or something like that. So actually you have a large burden of soft disease, there's an argument for that. But there are downsides to these too, because these things cross the blood-brain barrier. They prevent your brain from making cholesterol, which your brain is made out of cholesterol, right? And that cholesterol in the brain is past the blood-brain barrier. It does not get into the blood. So even if cholesterol did cause atherosclerosis, which it does not, it wouldn't be that cholesterol that was causing it, because that's inside the brain. And so that's only being used for the physical structures of the brain. And so you're stopping that. You're preventing your brain from working properly. And there are no end of studies. You go to PubMed, do this. Look up cholesterol metabolism, disrupting cholesterol metabolism, neurological issues, neurodevelopmental issues. And just punch in those keywords. You will see tons of studies showing that if you screw up the normal cholesterol metabolism of the brain, you cause serious harm to the brain, certainly in development for kids and the fetuses. That's exactly what statins do, is they disrupt the normal cholesterol metabolism of the brain. They also cause insulin resistance and diabetes, which is the #1 risk factor for developing heart disease. It's up there with smoking, right? So, you have to decide if that's something that's right for you. If you want some more information on that, you can watch my video on YouTube called The Truth About Cholesterol and Heart Disease, actually looking at the data on this. And I've even found much more data since then that supports, the fact that, that goes against the cholesterol heart hypothesis. Then you have to remember that if you have had a heart attack and you go on to a statin after the fact, that if you go on that statin for the rest of your life, and at least 5 years, that this will increase your life by about 5 days. And that's according to the drug company's own studies on statins, right? So that's the best it's ever going to look, right? Because they doctor things to make it look more favorable for their drug, right? And that's their study, okay? So if you have not had a heart attack or a stroke, it really doesn't increase your life at all. I mean, 3 days max, right? So is that really overall beneficial? Well, for some people, it's a benefit from a longevity perspective. What was the cost and what was the burden of harm from the side effects? The dementia, the Alzheimer's, the diabetes, etc. Just the expense. Was that worth the 3 days, 5 days? That's for you to decide. There's experimental study is good, but a reproducible experimental design, excellent. And if something hasn't been reproduced, take it with a grain of salt until it's been reproduced by somebody else in a distant location, just following the same steps and getting the same results. Then that's pretty good. So there are studies with statins. They found that, again, these cross the blood-brain barrier. They do prevent your brain from, making cholesterol normally, which does cause harm. We know that. That's all over the literature. And so they found that people with Alzheimer's that were on statins, that there was a reversible nature to this when they took them off statins. So they took them off the statins and they gave them MMSE, so a mini mental state exam, so looking at sort of a cognition score. They did that before, then they took them off the statins. 6 weeks later, they gave it to them again, and they had improved to such a dramatic extent, some of them wouldn't even be considered to have dementia at this point, just taking them off statins for 6 weeks. And then you put them back on statins, so it's a re-challenge study. Put them back on the statins. 6 weeks later, the MMSE score dropped back down to those dementia levels. That's pretty scary. So that's one study, but now it's been reproduced. So they've done that twice now. They've shown that same result in different people at different location, right? So that has been verified. Okay, it's replicable. It's a replicable result from doing that, right? So that's significant. So you have to decide if that's something that's worth it to you. It is your decision at the end of the day. It is something that you should work with your doctor to see if these benefits outweigh the risks. And there are risks, there are downsides to taking any medication. And so you need to calculate, are those downsides outweighed by the upsides? If you have a large burden of soft plaque disease and your doctor's like, look, we need to stabilize these things, then that's an argument. That's a discussion that you can have, and that would be reasonable. If you ever were to consider that, I would strongly encourage people to think about only considering statins that had a lower lipophilic sort of quality, so the ones that don't cross the blood-brain barrier as well. They all cross, but some cross more sort of readily, like atorvastatin, Lipitor. Most commonly prescribed statin, and is also the one that crosses the blood-brain barrier quite easily. So things like rosuvastatin are less likely or less able to cross the blood-brain barrier, but they do. And so having sort of on a lower dose, sort of like a half dose of something like rosuvastatin, so that's going to help mitigate some of those bad effects from statins. So these things, it's a bit nuanced, but I think it's not to lower your cholesterol, that's for sure. So all that stuff you talk about cholesterol, that is not what you consider useful for whether or not you go on a statin. That's useless. The benefits of a statin have nothing to do with cholesterol. In fact, that's a deleterious side effect of statins. The benefits that you're looking for is to stabilize the soft plaques, and that's even true. I mean, there's a lot of stuff that was taught in medical school that we still think are true today that we know are a complete hokum, right? So, not saying that that's the case with statins and solidifying plaques, but you know, I take everything with a grain of salt until I know for a fact it's not the case. So. That would be my thoughts on this. I wouldn't worry about your cholesterol. I would keep going on ketogenic carnivore diet. You'll keep seeing your HDL go up. You keep seeing your triglycerides go down. That's really what you care about. I don't care about anything else. In fact, I want to see things up a little bit higher because people live longer when their cholesterol is a bit higher. Okay, so eventually you're going to hope to get your HDL at least half of your triglycerides, because your triglycerides over half of or over double where your HDL is. That actually is sort of indication that you're in a higher risk group. That doesn't mean that statins are going to help. It just means that you're in a higher risk group metabolically. And so as you go with this, and you improve your sleep, you improve your stress, which can all affect your triglycerides and HDL, you should see improvement. So ketogenic carnivore diet, get proper sleep, reduce your stress, get out in the sun, exercise, right? High intensity exercise, lift weights, sprint, those sorts of things. You'll see improvement. And yeah, watch The Truth About Cholesterol and Heart Disease on my YouTube channel. You can watch my interview with Dr. Filippo Vadia, who is a cardiothoracic surgeon who's up the same thinking that I am. Dr. Asima Hotra, who is an interventional cardiologist who deals with this exact issue in the UK, and again, of the same thinking as well. And he wrote a book called A Statin-Free Life, arguing basically these things are not helping people and probably shouldn't be taken outside of those nuanced situations. So good luck with that. Okay, so Sven Mooring, thank you so much for the super chat. Good morning from Germany. Good morning. Do you have patients with myalgic encephalomyelitis who get better with a carnivore lifestyle? That's a good question. It's also not common enough that I've really seen that. So unfortunately, I wouldn't be able to. I don't know if I've actually seen anyone that has had that and has tried carnivore and told me about it and told me what the results are. Unfortunately, again, whatever your condition is, this is going to improve your lot in life regardless. And so it can improve your situation, can improve your condition, and just help you be better and healthier overall. Could this help this situation? It could very well, but unfortunately I don't have the experience with it. I can tell you one way or the other. I can tell you that inflammatory issues in general massively improved. Neurological conditions, I've seen miraculous improvements with multiple neurological conditions. I mean, there's a guy, Dave Mack, who had a stroke 30 years ago and has had right-sided weakness for 30 years, and that actually improved on going on a carnivore diet. And he was ketogenic before that too, did Atkins, did keto. It wasn't until he went carnivore that his neurological function actually started improving, and actually dramatically improved. In a couple of months, he was walking normally. You know, still a bit of weakness there, but it's massively improved. 30 years later, that's not supposed to happen. You know, the teaching is, and what we tell people in neurosurgery and neurology is that if you have a stroke, if you have damage, you have some sort of issue, you've damaged your brain, you've damaged your nerves, you can heal up to about 2 years, and after that, you know, you're not going to heal anymore. This was 30 years later, right? So that's massive. So I think it's definitely worth a try, and it's definitely something that you or they would be it would be well worth trying, because you're going to get a lot of improvements anyway, and if it does help with that, that would be amazing. And so hopefully it does. And you know, regardless of whether it does or doesn't, please do report back if they or you try it, to see, because that's something, you know, I mean, there's some things that you know, maybe you're like, oh yeah, there's all these people that tried it, doesn't seem to help with that, but they improve in these other ways, so it was still a good idea. And then we find out other things, like people with multiple sclerosis that massively improve their condition and their symptoms. And then on MRIs, their lesions shrink. And we're getting ready to publish a case series on that. And that's dramatic because that's never been shown before, that you can reverse lesions. It's never been shown before. So that's pretty exciting. So definitely worth trying. If you're going to do this for any neurological issue, check out my my MS protocol. It's basically anybody with a CNS sort of issue or any sort of neurological issue. It'd be good to do this because just help to optimize. Now, any sort of carnivore diet is better than anything else, but you're really fine tuning this to get sort of the best out of this, to get the maximal best results. It can be really, really helpful as well. And so maybe give that a try, do the MS protocol, because that's applicable to any sort of neurological issue. That should be on my website, DrAnthonyChaffee.com. I don't know where else it is. It's on Twitter, things like that. I can probably pin it to the top of my X Twitter thing, but it should be on my website. And if not, I'll make sure that it gets on my website. Okay. So we have a last couple super chats here. We'll probably end it at that point. We go about an hour, which is usually a good amount of time. And on other days, if I have more time, I'll be able to go longer. But for today, we'll just do these last two super chats and go from there. Arend Govar, thank you so much for the super chat. My girlfriend has chronic heartburn. Can you speak to the carnivore diet for reducing or eliminating heartburn? Well, for a lot of people that it does, and that's just because you're eliminating things that can contribute to heartburn, such as increased acidity from insulin. So you're eating carbohydrates, it raises your insulin. Insulin increases the hydrogen production in your stomach, so it makes things more acidic and it makes things more, problematic, and you can get this heartburn. But also you're getting things in plants that can actually lower your protection for your stomach lining and cause more problems, and have your body be more sensitive to itself, sort of thing. And then a lot of different, maybe even spices, this and that can cause reflux and all these other sorts of things. You're getting rid of all those things, but even just normal plants can actually cause heartburn. It can cause an inappropriate response and effect to your own native stomach acid, or make that worse in some fashion that can give you heartburn. So a lot of people do find that going carnivore improves their heartburn. I've seen some that it's still not enough, but it could be something else. It could be an ulcer, there could be gastritis, there could be other sorts of things that would need to get addressed, and potentially even treated medically with like a proton pump inhibitor or something that short term, not something you want to take long term, a month or so, just to let your body heal and then get on with life. Because there can, there's increased cancer risk with long-term PPIs, obviously increased malabsorption issues because you're not able to break down food properly. So that's important to remember as well. But a lot of people, it does improve, and so hopefully that's something that she is willing to try at least, and hopefully it does help. Okay, and last but not least is Enes Sahin. Thank you so much for the super chat. Hello, Dr. Chaffee. Been on carnivore for the last 5 months, eating mostly chicken and dairy due to cost of red meat. How can I get enough fat and nutrients with this budget? Thank you for your work. Well, I mean, you can certainly do this on chicken. Just make sure you're focusing on the dark meat and with the skin on. It's usually cheaper anyway. The dark meat's usually cheaper. Skin on can often be cheaper as well. And so, and cooking butter, use those sorts of things. So dairy is good. Use ghee, use butter, add a lot of butter. Eggs, things like that. If eggs, eggs are bloody expensive. It's like $1 an egg in some places. But if eggs are affordable in your area and in your budget, then that can be a good option as well. The egg yolk is 2-to-1 fat to protein. So if you even just have the yolks, first of all, they taste a lot better. I had an egg yolk omelet. It's amazing. It's absolutely amazing. Way better than an egg white omelet. It's better than normal omelet. It was fantastic. It was so rich. It had so much nice flavor. It was really good. And so you can try that. You can try eggs with a lot of butter. So butter is a good way of getting extra fat. You can also ask a butcher to give you the fat trimmings, because they trim off a lot of this fat because nobody wants it. You want it. We want it. So ask them, say, hey, can I buy that from you? And a lot of butchers will just give it to you because they have to pay to get it taken away. If they are going to charge you for it, don't pay too much for it. You know, like here, there's a lot of butchers in Australia that will sell excess fat for like $5 a kilo, something like that. I've seen some people try to sell it for like $20 a kilo. It's like start charging steak prices for fat that they're throwing out and they have to pay to get rid of it. It's like, yeah, go to hell. Elle was trying to get chicken skins in order to do little, little dumpling wraps, using chicken skins for that. And she asked him, like, do you have this? So like, we actually have some, we can set some aside for you. And she was like, okay, well, how much would that be? They're like, yeah, it's like, $20 a kilo. She's just like, and I told her about this. I told her that they have to pay for it to get rid of it. She's like, oh, okay, do you guys use this for anything else? Like, no, we don't use it for anything. I was like, oh, do you just toss it out, or do you have to pay for it to get to it? Yeah, normally we pay for it to go away. So she said, okay, so if you have to pay for it to go away, and I'm willing to take it off your hands for free, like, why are you charging me $20 a kilo? Like, that's more expensive than the chicken itself, And they're like, yeah, that's fair enough. And they ended up charging her $5 a kilo. But yeah, so because it's not something that's normally bought and sold, they may have to figure out the prices. But it should be very cheap because this is a throwaway product, right? And so, definitely get that for a less expensive price. So fat trimming is really good option, and you can sort of cut those into little chunks, fry them up lightly so you're not losing a lot of the rendered fat. And then just have that little pile of fat next to the meat, eggs and things like that. Use a lot of butter, those sorts of things. So, and dark meat, skin on. Those are sorts of things that I would do to keep the fat content up. Okay. All right, great. Well, that was a good hour and 6 minutes. It felt very, very fast. So that sort of flew through. So yeah, hopefully that was helpful for people. Thank you all for joining in. Again, very sorry for the delay in getting through my meetings to be able to come here. We'll meet again next week, probably a bit earlier next week, hopefully, and then we'll be able to go a bit longer. Okay. Thank you all very much. We'll see you next time.